Thank you for joining us for the Behavioral Health Workforce Education Training for Professionals, or BWET Pro Welcome Webinar. I'd like to highlight a couple housekeeping items for you in Microsoft Teams. The features available to you can be found at the top of your screen. If you have any questions during today's presentation, we ask that you type them into the Q&A pod, once again located at the top of the screen. For some attendees, you may not be able to see the Q&A pod, so you can use the chat, but we do ask if you see the Q&A pod, please type in your questions there. Thank you again for joining us today, and we hope that you find this webinar incredibly helpful. Now I'd like to turn the presentation over to Cynthia Phillips. Cynthia?
Thanks, Carl. Hi, everyone. On behalf of HRSA's Bureau of Health Workforce, we want to extend our congratulations to you all, both new and returning awardees, for being awarded the Behavioral Health Workforce Education and Training for Professionals Grant, or BWET Pro, as we like to call it. In the project years are from fiscal year 2025 to 2029. As you likely know, it was a very competitive process, which means your applications scored very high, in fact, the highest amongst them. And we're so excited to work with you all. I'm Cindy Phillips, the Director of Behavioral Health Workforce Initiatives within the Bureau of Health Workforce at HRSA. I have been with the Behavioral Health Workforce Program since January 2025, so relatively new. I cannot tell you how thrilled I am that I'm leading these successful programs with the goal of expanding mental health and substance abuse workforce to address the shortage and especially amongst the increasing demands, particularly in rural and underserved communities. I'm a social worker by training, so even though it was quite a while ago, I remember my training at the University of Minnesota School of Social Work, and I also did a dual degree with the School of Public Health. And I will say that my social work field experiences were some of the pivotal moments in my career. I trained in a community health center in underserved community in Minneapolis. I was a medical social worker and a parenting group facilitator for pregnant and parenting teens. And in fact, as is often the ideal, my field placement turned into a full-time job following graduation. I've been at HRSA since 2010, so about 15 years, where I worked in various leadership positions with the Community Health Center program. I worked on health professions programs, mainly related to public health and interdisciplinary education. Then I spent the last 10 years working on early childhood health development and well-being at the Maternal and Child Health Bureau before moving back to the behavioral health workforce world. Throughout my career, a resounding theme has been that there aren't enough providers to address the significant mental health and substance use disorder issues that exist in our country. For those of you who may remember, the BWET program was established in 2014 through the Now is the Time initiative. And the goal was to expand not just the behavioral health workforce for professionals, but also for paraprofessionals. The program seeks to increase access to behavioral health care services, developing interprofessional training and behavioral health integration, and implementing experiential training with a special focus on children, adolescents, and youth. Over the years, I'm pleased to say that the budget has more than doubled in size, which means that we're able to support more grantees and more students. The purpose is expanded to serve high need and high demand areas. As you saw from the Notice of Funding Opportunity, there are many disciplines and educational levels that have been added over the years. And I hope that the previous award recipients have seen that we were able to increase the stipend amounts with this next iteration of the program, which is so exciting. We're so happy that we were able to make that happen. Today's session is designed to serve as an orientation and guide to BWET Pro. We'll be covering information specific to the grant, including a program overview, key reminders, reporting requirements, and more. Next slide. For our agenda, we'll provide a cohort overview. We'll go over program requirements and deliverables, talk about some of the next steps, and then hopefully we'll have plenty of time for Q&A. First, I'm going to introduce the key BWET Pro staff. Next slide. So first we have Sarah O'Donnell, the branch chief for behavioral health programs. Isabel Gorgoroso, the team lead for professional programs. Next slide. And now to our amazing project officers who you can see on the screen. We have Antoinette Agarwal, Alita Juri Carter, Courtney Lebitsky, and Chinomso MMA. Most of you either know these project officers because they have been with you for a while, or you were able to meet them on your onboarding calls. We're trying something a little different this year, and with this cohort, the POs are assigned by discipline as much as possible. So for example, Chinomso is overseeing the social work programs. Alita Juri, the psychiatric mental health nurse practitioner and occupational therapy programs. Antoinette is overseeing counseling and marriage and family therapy. And Courtney, who also works on our graduate psychology education program, is overseeing psychology programs. This allows us to have greater expertise on our team related to education and training requirements for the many, many disciplines covered by BWET Pro. I also want to recognize our GMS, Nandini Asar, who hopefully was able to join us today, but is always available to you as well. The project officers and the GMS will be your best resource for questions about reporting, managing a federal grant, performance measure process, and so many other items that come up on a daily basis. I will let you know that we will have a technical assistance provider that's responsible for helping you with many facets of your grant, from performance measures to recruitment and retention of students, to providing networking and learning opportunities. We'll be able to announce the provider in early September, so please stay tuned. So now I'm going to turn it over to Alita Juri, and I think she's going to lead us in our first poll. So Alita Juri.
Hello, everyone. Thank you, Cindy. Next slide, please. Before we dive in, we'd love to get a quick sense of where everyone is joining us from today. You can scan the QR code on the screen to add your location to a word cloud. Someone from our team will also place the link into the chat if you would like to access it in that way. It'll just take a moment. Feel free to drop your location in the chat too, if you'd like to. This helps us to get a better sense of the geographical representation on today's call and gives everyone a quick window into who's in the room virtually. We'll share a little bit more about the overall cohort in the next slide, and we'll wait a few moments so that people can answer the poll. All right, it looks like we have, I think that's 89 people, 90 people logged into the poll. And so thanks to everyone who responded. It's great to see where you all are joining us from today. It mirrors the geographical representation of this year's cohort. Next slide, please. Thank you, Chinomso. As shown on the map, this slide provides a visual snapshot of the FY 2025 cohort. This cohort shows the various geographical areas with the highest concentration of awardees, spanning across both coasts. This distribution demonstrates the program's broad national footprint, creating opportunities for regional collaboration and knowledge sharing. Overall, the geographical representation allows the BWET Pro program to address unique community needs, from rural health challenges and parts of the plains and Mountain West to urban populations in the Mid-Atlantic. Next slide, please. In briefly reviewing key details regarding the disciplines trained within this cohort, our programs support individuals at multiple critical stages of professional development and across a multitude of health fields. Feel free to take a minute to read off some of the disciplines that will be trained with this award. Next slide, please. And now I have the pleasure of transitioning the presentation to my colleague, Antoinette.
Antoinette, you're on mute.
Sorry about that. Okay, thank you. Thank you, Cindy. Okay, so with this poll, we'd like to know your experience with HRSA grants. So we just want to get a quick sense of your experience, and you can go ahead and scan the QR code on the screen to answer the short poll, or click the link in the chat. Now, whether this is your first time or you've been a part of HRSA-funded programs before, we just want to know. And it helps us tailor today's session and future support to better meet everyone's needs. Now, there are no wrong answers. We just want to get a feel for the mix of experience in the group. Well, I can say thank you for completing this. And we're happy to see that many of you are familiar with HRSA grants and are continuing to do this great work. Now, for those of you who are new to HRSA grants, we can't emphasize enough through the onboarding reference packet that we provided that you need to look through the EHB knowledge base. I hope you can also view your project officer as a resource if you have questions or you're not sure about something. Now, we do have one last poll for today, so if you can move to the next question. Now, in one word, we want to know what you're hoping to accomplish with this grant. And once again, you can either scan your QR code or click the link in the chat. Now, this is a great way to see what's top of mind for the group and what we're all collectively aiming for. And it's also inspiring to see the common themes and the diversity of the goals in a cohort like this. So I see some recurring themes as access, training, impact, and supporting, whether that might be supporting underprivileged populations or students. Equity is another theme that's popping up. But in any event, as you can see, this grant has the capacity to do many, many great things beyond the goals and the objectives that have been listed in the NOFO. And on that note, next slide, please. Now, speaking of this program and its legislative authority, I'm just waiting for the next slide to pop up. So the BWET program is authorized by 42 USC 294E 1A Section 1.3, as you can see from the slide above. Now, this section of the law authorizes the Secretary of Health and Human Services to provide grants to support mental health and behavioral health education and training to increase the number of professionals in mental and behavioral health care in underserved populations and for high need populations. Next slide, please. Now, this slide lists high-level details of the BWET Pro program, which include the goal, the project period, the number of awards, and total funding at $59.3 million. I just wanted to reiterate that we have awarded 105 programs, which is more than we originally expected. The NOFO anticipated originally 101 awards. Now, we understand that many of you received award notices after your usual matching cycle, and you may not be able to recruit your full number of trainees for your first year. That's totally understandable. Now, if this is your circumstance, your project officer will discuss next steps and plans to catch up on the number of trainee numbers. So the next slide goes over the program objectives. Next slide, please. To achieve the program's goal, you'll need to complete the following 4 objectives as outlined in the Notice of Funding Opportunity. Now, just to expound on each of these 4 objectives, objective number 1. First, this program focuses on increasing the number of new or expanded community partnerships with experiential training sites in high need and high demand areas where you'll ultimately increase access to behavioral health services as well as expose trainees early to such training sites. Objective number 2 strives to promote collaborative training by using team-based models of care to integrate behavioral health care into interprofessional primary care settings to provide a more holistic approach to patient care. Now, the third objective recognizes the need for a qualified workforce interested in working with children, adolescents, and young adults. And the final and fourth objective emphasizes the crucial role clinical supervisors play by recruiting, developing, and expanding the capacity to train these supervisors to support and mentor behavioral health trainees. Next slide, please. This slide reviews some of our program requirements. Now, it's a general summary of the requirements. However, for a full list, you can refer to page 11 of the Notice of Funding Opportunities. Now, just to kind of go through a high-level description of each of these program requirements, programs must provide didactic and experiential training in behavioral health and its integration into primary care settings, school settings, or other subspecialty care. Programs must incorporate technology to improve digital health literacy, provide interprofessional training programs for faculty and field site supervisors. Programs must assist students with job placement, post-graduation by establishing community partnerships. And finally, programs must collect National Provider Identifier numbers, otherwise known as NPIs, from all trainees before the end of the first year of training. I cannot emphasize how critical this is, as you will not be able to complete your annual performance report without these numbers. We'll talk about this further along in our presentation. And the final 2 are the program must provide continuous quality improvement for formal program evaluations, and programs must participate in occasional federally designed evaluations upon request. Now, the next slide basically kind of introduces you to your reference guide. Next slide, please. Reporting requirements. Okay. Sorry about that, folks. I got my notes out of order. Could we actually move forward to the reference guide and then move back to reporting requirements, please? Okay, one more. Okay, thank you. Okay, so in terms of your reference guide, this is just a reminder to review the reference guide that was emailed to you in July. It's a comprehensive resource with information about your program, key contacts, reporting requirements, and more. And when you have questions, consult the reference guide first, then refer to the NOFO for any clarifications, then review your notice of award to ensure that you're meeting the terms and conditions listed. Now, I'd like to reiterate some highlights from the guide. The EHB help desk number is listed in there in case you run into any technical issues. And I'd like to take a special opportunity to talk a little bit about EHB. Our office wants to acknowledge that HRSA is in the process of transitioning to a new grant platform called Grant Solutions and away from the electronic handbooks. Now, for the time being, it won't impact you. And you can still reach out to EHB if you have any technical issues or questions related to the platform. However, we will keep you informed and in the loop as we learn more information on the matter. Now, your reference guide will also list information on issues like submitting common prior approval requests, and you would submit those for things like budget revisions or changes in scope. It also contains a deliverables calendar listing important reporting deadlines. And then one important final reminder. We just want to let you know that when you're communicating with your project officer or grants management specialist, always include your grant number in the subject line or body of the email, as this will help us respond more quickly and accurately to any of your requests. And on that note, what I'm going to do is I'm going to pass this along to Courtney. And if Courtney, if you can take that along, and then maybe we can loop back to the reporting requirements for the 3 reports.
Of course. Thanks,
Thank you,
Antoinette.
Courtney.
That was a lot of great information.
Thank you.
I'm going to hop forward to discussing the standardized work plan. As everyone on the call knows, your standardized work plan appeared as a condition on your grant. However, the SWP must be entered into the EHB interface, not uploaded as an attachment. The task to enter it in is separate from the condition. The standardized work plan interface on EHB facilitates the creation of your quarterly progress reports. To generate the task that allows you to enter the SWP into the EHB interface, you must assign yourself as a project director on the grant. I'm going to review that process in the next slide. Please be aware it may take a few days for the correct work plan task to generate after you assign yourself to the grant. It has taken some folks up to a week for the correct task to create in their EHB to complete. And after you have entered the standardized work plan into the EHB interface, you can upload a blank document into the condition to be processed and removed regarding the condition on your award. So there are 2 separate things you will do. You will upload a blank document into the condition on the award as an attachment, as well as complete the form submission, which I will show you in the next slide what that will look like in EHB. Next slide, please. So again, you will need to assign yourself as the project director on the grant, and the process is on the slide as well as in your reference guide on page 5. Excuse me. Please note that this is required for all awardees. That does include competing continuations. I recognize having 2 tasks to complete in EHB can be a bit confusing. So if you're unsure if the correct task has generated, this is what the tracking number should look like in EHB. You'll see SWP as the first 3 letters of the tracking number, which is illustrated here on the slide. And your project officer can assist if you're having any issues getting the correct task to generate. Next slide. I just saw a question pop up. That answer's right here. Excuse me. So in an effort to standardize the standardized work plans across all BWET Pro awardees, we provided a template for the standardized work plan submission. Please copy and paste the goal and the objectives from that template into your standardized work plan form. We have updated the language from the NOFO. So again, please use a template to copy and paste the goal and objectives. Additionally, you will see there is a fifth objective listed in that template, and that also differs from the NOFO. This was added to ensure a single location related to data collection and monitoring was in place. However, it is not a new requirement of the grant. It is essentially a restructuring of the program requirements to provide standardization among all the programs. The goal is to have this submitted to your project officer by the 5th of September, 2025. Please reach out for additional guidance if needed to your assigned project officer. Next slide, please. Okay, I'm going to move on to carryover guidance. So this is specifically for competing continuations. If you have unobligated funds that you want to carry over into the next award, meaning this current award, 2025, you will need to complete the prior approval process in EHB, no matter what the amount is to be carried over. The carryover is not automatic like it has been in previous years, as we are at the start of a new award. Your carryover will be available to complete after the federal financial report is submitted in EHB. And please remember to mark that you will be requesting a carryover request in the FFR. The carryover request should include what is listed on the slide here. And carryover requests must be submitted within 30 days of submitting finance report. Next slide. Okay, that was a lot of information. So what's next? You will need to address all of the conditions that are listed in the notice of award by September 15th, other than the work plan, which will be due on September 5th. You'll be interacting with your project officer on a bi-monthly basis, and you'll set up those calls soon after your onboarding calls with your project officer. For additional assistance related to programming, you should consider engaging with the technical assistance provider, which your project officer will discuss with you further down in the year. And lastly, your first deliverable will be the quarterly progress update, or QPU, which will be due October 15th, 2025. Again, that will be automatically generated for you in EHB. Information about all the topics here can be found in that onboarding resource packet that Antoinette spoke to. But of course, if you have any questions, you are free to reach out to your project officer. Next slide, please. Okay, so when producing works created with HRSA funds, federal awardees are required to use this language when issuing statements, press releases, requests for proposals, bid solicitations, and other HRSA-supported publications and forums describing projects or programs funded in whole or in part with HRSA funding. This also includes websites. Examples of HRSA-supported publications include, but are not limited to, manuals, toolkits, resource guides, case studies, and issue briefs. And before going to the available resources slide, if there's an opportunity to, maybe we can go back to the reporting requirements.
Thank you, Courtney, on that. I found my notes for the reporting requirements. Now, this slide basically lists 2 of the 4 required reports for your grant. I think that Courtney brought this up before. She mentioned the quarterly progress updates, or otherwise known as the QPUs. These are more frequent reports, and they're submitted quarterly to track progress. They basically complement our recurring bi-monthly one-to-one meetings with your project officers and helps us better provide support for you throughout the year. Now, these reports are generated based off of your submitted standardized work plan. The next report is the non-competing continuation progress report. And that one is essentially the big qualitative report, typically due annually in March. It asks how your work so far supports your original plans and what your future plans are to continue progress. Now, the third report is the Federal Financial Report. It's not listed here as it's not programmatic, but budgetary in nature, and you'll work with your GMS on that report. Just as a reminder, your HRSA GMS contact information can be found on your notice of award. Next slide, please. The annual performance report. This report is the fourth required report. It's a major quantitative report due by July 31st each year. Many of you are familiar with this, having just submitted it recently for your previous award. For those of you who are new to the grant, we strongly recommend reviewing the report on your grant link in EHB, which has the most recent APR manual. We think that it's really important to start thinking about the APR early and the data that you'll need to collect to ensure success with submitting your report next June. Now, with that in mind, we just wanted to kind of give you some helpful hints on the data that you would need to collect for this report. So one of the program categories is called program characteristics. And in that area, you would collect the number of trainees enrolled or participating in the training program. Another section of the report is called individual training characteristics. In that, you would collect data on demographic details for all HRSA-funded trainees. You would track contact hours for patient encounters. You would also track hours where your trainees are working in different settings, like rural settings, in telehealth, primary care, and more. And just a quick note on patient encounters. Remember to gather data where you're ensuring that you track individual data, not just cohort-wide total numbers of encounters. The report also requests for training site information, where you would gather site address of the training site, the type of site, and general information for all training sites supported by the grant. In that section, you'll also track the number of trainees per site, including your trainees as well as other interprofessional trainees. There's a section on course development and delivery where we ask you to report on attendee counts by discipline for any courses developed and to provide descriptions of training topics and delivery methods. You can also include courses like legal medical partnerships or stigma reduction. And there's also a section that asks for data on faculty development. Now, additionally for the BWET program, your APR will ask for data on non-BWET funded trainees who benefit from the curriculum or training sites that were developed under this award. So be sure to collect and capture information and data on those trainees as well. Also, keep track of interprofessional trainees. The report will ask about other non-BWET funded trainees who worked alongside your students. Now, just a hint on the annual performance report. The reporting manual changes every year. So the details here reflect the most recent annual performance report, which was due July 31st. Now, while the manual updates annually, there's core data, and the core data collected remains consistent from year to year. So we strongly encourage you to review the latest manual carefully to ensure your data collection aligns with the current reporting requirements. So for more information, we suggest that you refer to the latest BWET reporting manual. On that note, I'm going to punt it back to Courtney Levitsky for kind of some final information on resources and for any questions and answers. Courtney?
Thanks, Antoinette. There are additional resources to guide you on your federal grant management. Again, these slides will be sent to you after today's presentation, and these are clickable links for you to be able to access, as well as I believe they are in your onboarding or resource manual as well. If you haven't already read the HHS grants policy statement, I would encourage you to do so to become more familiar with the grant process, allowable costs, and etc. Next slide. Please feel free to connect with us on our social media platforms. Next slide. And then we do have a little bit of time for some questions. I'm going to, I think, hand it over to Isabel to answer some of the most commonly asked questions that we're seeing in the Q&A and chat.
Thanks, team. Hi, everyone. So we do have a number of questions coming in. So let's see. Just to reiterate, SWP due September 5th. Let's see. So what was that? No more than 5 sub-objectives per objective, or 5 milestones per objective. Courtney, can you help with that one? That one I think was referenced from your slide, right?
I believe so. So I think the question is asking milestones versus sub-objectives versus objectives. And I really wish I could, I've been trying to drop into the chat the template that we created for the BWET Pro awardees for the standardized work plan. But you'll need to link up with your project officer to see it in this moment. However, there are 5 objectives that are in that template, specifically objectives. As it relates to sub-objectives or milestone activities, we don't have a minimum requirement related to like a numerical value for sub-objectives or milestones, recognizing that we don't need 50 milestone activities. We want it to be a manageable amount for you to be able to report on quarterly. And so I do think that in the chat, Carrie had mentioned sort of a maximum number that we're expecting to see related to milestone activities or sub-objectives. I'm trying to find it as I scroll through. However, I hope that answers the question. There are 5 objectives that we are asking for that are listed in the template. We do not have a minimum amount or maximum minimum amount of sub-objectives or milestone activities associated with those, but recognize you will be reporting on these things quarterly, so we don't want hundreds and hundreds of those either.
Thank you. Let's see. So the APR, we have a few trainees at multiple sites. Is there an option to list more than 1 training site? Yes, there is. On your APR, you can add as many sites as you use. And so we added the link to the slide deck. You can see the instruction manual from last year, as well as the table. So it will also give you like the columns to be able to know which data to collect. So you'll be able to see that. And in the instructions, it'll say that you can add as many sites as you need. The SW template. Regarding the NPI number, students will not complete graduation to apply for an NPI until after the APR is due in July. How should we handle this? So I believe for this round, the NPI was strongly encouraged in previous iterations. With this iteration starting in 2025, it is a requirement, but I do believe that you have the first year to say not reported. And if you do get a validation error, we will work with you. But you should be able to provide a not reported, and then when they do get it, you will be able to add it to your report the following year.
Sorry, Isabel, I just want to clarify.
Is that
actually it is required? And a couple of people wrote in the chat that you can find some great guides for how to apply for NPIs. And yes, in fact, students are eligible to apply for an NPI. So all of the trainees who are receiving stipends will need to report this year. You did not need to report in this most recent performance report, but you will need to report NPIs or it will lead to validation errors. And we will provide technical assistance and all of that throughout the year. So yes, I just see students may apply for an NPI.
Did you want to add something, Antoinette?
Yeah, actually, I did. I just wanted to give a shout out to one of my new grantees, Marquette University. I think they have a really, really effective way in terms of best practices for being able to um, encourage students to apply for their NPIs. So, what they've done with their program is that they've chosen to add that as a condition of their award letter. And so they've added it in there. Just to kind of ensure that they, as a grantee, are going to be able to, meet this requirement, meet this, reporting requirement for us. So I think that's a great way of being able to ensure that you can get that information and get it in a timely manner. So I just thought that I would add that.
Thank you. Okay, so this is our first year. Is there a way to access the previous year's APR manual as a reference guide? Yes. So in the slide deck, as I mentioned, there's a link to the, it's last year's APR, but it was just submitted this summer. So it is the most current, and it does change slightly from year to year, but it is a lot of similar information that you'll see next year. When the APR asks for the graduation status of BWET students, does this question refer to BWET program graduates or student graduates from their respective behavioral health departments at the university?
It refers to graduates of the BWET program.
Yeah, from their specific BWET program. Can this slide deck be shared with us for reference? Yes. So after the recording or after this presentation, we'll get a copy of the recording that will go out to all the grantees, as well as a copy of the slide deck. I found that the videos in the EHB don't play. The error message said I did not have access, although I'm listed as the program director. What specific videos in EHB? If these were the previous how-to videos in EHB that were super helpful, yes, they do not work anymore. But if you are having trouble with access, I would reach out to Tier 2 and they'll be able to help you. And it is on the resource slide to get Tier 2 support. Can the carry forward slide be shown again? Do you mind bringing that one up, Chinomzo? If EHB says the SWP is 8/15, how do we get this updated? So the deadline is a soft deadline for that 8/15 is a soft deadline. So please do submit it by 9/5. It won't be updated in EHB.
But what slide did you want?
The carryover. Yeah. Thank you. Will you be addressing grant closeout reports in this presentation? No, not today. We can go into more detail. Typically, it's at the end of the program. But if you have any questions, if you're like a competing continuation that was re-awarded and you need some follow-up with some of the closeout reports, do reach out to your project officer. But we did not go into detail on those reports today.
And you should have the slides from the closeout webinar that did happen. I believe everybody's shared them, so you should have those, or you can ask your project officer to share those with you.
And Alita, did you want to add something?
Yes, so 2 talking points. I dropped the information into the chat, but on page 15 of the grantee reference guide, which was included in the welcome email, it gives the web link for the MPI instructions. And then if you go to that web page, there is actually a phone number. I've actually personally called that phone number and asked them questions, and they were quite helpful. So I do encourage all project directors that have questions about NPIs, specifically about enrolling students for the NPI, to contact that number. Otherwise, another good way to find additional value from this is to network in the chat. So if you are a newer project director and you see more experienced project directors commenting in the chat about how they were able to establish workflows or add value to their letters of agreement with their students, I do encourage that you utilize this opportunity to exchange contact information to be able to connect and maybe learn some, be able to learn from some of the lessons that the more experienced project directors have. And then as a final point, in reference to the final program report, we won't be presenting on this today, as Isabel said, but if you look in your original notice of award from your original budget period, you will see that there is language about the final program report within your original NOA. And then there's also a bit of language that was mentioned in the year 4 deliverables calendar for the previous project directors.
Thank you. For those of us with a continuation grant, do we have to complete a final narrative report? You will eventually, but the final narrative report, because your grant is continuing, is not due at this time. If there is additional reporting, because typically in your final year, you have the final report because you no longer have that NCC progress report, but because now you don't have the final report because you were reawarded, we'll follow up about a progress report if needed. Just to clarify, we should delete the objectives from our original proposal that came up in the SWP and the electronic handbook and replace them with the objectives from the template. Correct. Regarding the APR, could the new manual be released to us 4 to 6 months before the report is due? This way we could collect all the information that you were requesting before the trainees are graduated and gone. So we are working to provide more and sooner technical assistance with regards to data collection and the APRs. Our division doesn't produce the manual. So they have their timeline. It's a different division in BHW. And so we may not be able to release it sooner, but we can work to provide more technical assistance in helping share the data that is to be collected and maybe ways to collect that data. Will you provide a list of grantees for this award for collaboration? So to follow up on Alita Jury, this is a great opportunity to get contact information from fellow awardees. I will also say that on grants.gov, data, HRSA, data.
The data warehouse?
Yeah, but I'm blanking out on the website, data.hrsa.gov. You can look up all of the grants there. You can search by program, by activity code. It has an abstract. You can see who the project director is. You used to be able to see project director and contact information, but you can at least see who the different award recipients are for this program and other programs if you're interested. Our BWET collaborates closely on a core training program with a GPE grant. How do we count extra trainees involved in the programming without double counting? I would work closely. This is a really good question. And I would follow up with your project officer just to make sure that we aren't double counting and that we are reporting them on the correct APR. But I think we'll probably have to get a little bit more detail about how to address that one. I'm wondering if students will feel uncomfortable listing their home address in their NPI application as this information then becomes public. Can students list the university of their workplace address instead of home address? Cindy, do you know the answer to that one?
I actually do not, but somebody else may know the answer to that. So if you do, if you could put that in the chat.
What if we have 9 objectives? Do we have to change the object? Apologize, my screen just refreshed.
So a couple of people said that they list the school address. So that seems to be okay.
Good. In EHB, we have 2 tasks related to SWP with different dates than what your team mentioned. One is 8:15 and the other is due 9:15. Is there a glitch? No glitch. So the 8:15 is a soft deadline, but it is due. We're asking grantees to please submit by 9/5. I know that's not one of the ones that's listed in there, but please do submit by September 5th because it does give the project officers enough time to review, send back. A lot of times there are edits that need to be made. And so we just want to make sure that we have enough time to process, review, approve them by the time your quarterly progress update goes out for you to fill out October 1st. And so that's why we're asking them for September 5th.
Somebody asked about sharing a Google Sheet so people can sign up, and I'm fine with that if you have something produced that you want to share a link for others to enter. So somebody's very proactive and already has that. So I think that's a good opportunity to connect with one another and share contact information.
Thanks, Cindy. To clarify, we have already submitted an updated PDF version of the SWP on EHB. Should we wait for feedback on the SWP or go ahead and input it in digitally in EHB? So the attachment one, the PDF, it's really just a blank copy that we need you to just upload, because the one that we really need and that we will review is the one in EHB. So I would go ahead and input it digitally in EHB into the interface that Courtney mentioned. But if we have 9 objectives, do we change the objectives to the 5 in the template? Yes, because I do believe it said a maximum of 5. I do believe there's a student taxonomy for NPI. Thank you. Yes, the SWP that you submit should only have 5. Please remember to enter questions into the Q&A. Thank you. I'm looking for questions. A lot of helpful feedback. I really appreciate sharing best practices and tips as we navigate through the new NPI requirement. Is this a specific type of NPI related to just students? That was our understanding, but we are unfamiliar with that variation. It is a regular NPI or student version. I think you answered that one, right, Cindy?
Hi, this is Alita Jaree. I'm not sure if Cindy is available right now, but I just wanted to chime in. So there is a separate taxonomy. A taxonomy is a grouping of codes. There's a separate taxonomy for student NPIs. If everyone can go to that NPI website, and if you have questions, call the number. I think they will be very helpful and supportive with helping you get the information that you need. As other project directors have mentioned in the chat, there is no limitation to healthcare professional trainee students. And I have personally verified this by calling the 1-800 number that is on the website.
Thanks, Alita Jaree. Still looking through questions. I think some of these were already answered. Yeah, so just reiterating that the deadline won't be updated in EHB. It is September 5th. Add a blank document to the SWP task that's asking for a PDF or an attachment, and then the one that you have to enter in is due September 5th. For the APR, do you want us to report all non-stipend funded trainees who are trained at the same site, same time, no matter the profession? I thought we needed to report other trainees from the same discipline. Is this in reference to the engine form? So for the APR, we do want non-stipend funded trainees if they did participate in a training that was funded through the grant. I hope that helps. If it doesn't answer your question, reach out to your project officer, because I think we need a couple more details to be able to provide some more guidance. Some connections. That looks good. We will share the presentation. We'll give you a copy of the recording as well as the slide deck. We did an extension without funds, a no cost extension in EHB as a prior approval. Did we do it wrong? No, you did not. That is correct. So if you were a 2021 recipient of the BWET program, then your program was scheduled to end this year. And if you applied for a no cost extension, you submit it in prior approval. So it should be under review by HRSA. If you don't see that it is in progress or under review, do reach out to your project officer. More connections. Reviewing the deadlines, 8/15 verse 9/15. So just a reminder, September 5th for the standardized work plan. If you go back one slide, and Chinomso, please. Sorry, 2 slides, 3 slides. Thank you. Yeah, the one with the circles. Yeah, that one. So it does say in the first circle, address all your conditions by September 15th, but the SWP task is due September 5th. So I did want to highlight that first circle, that if you do have any conditions on your award, please do review that notice of award. On your NOA, it will tell you if you have any conditions. Those are due by September 15th. If you don't know where to look, or you haven't seen any, or you don't see it in EHB for whatever reason, please do reach out to your project officer. I can continue going through questions. Did anybody else from the team have anything to add?
I just see one comment that's at the very bottom. I haven't scrolled back up recently. So if you put a comment or a question in the chat and it was missed, please feel free to reiterate it to kind of bump it at the bottom of the chat. But in reference to the no-cost extension, the no-cost extension is not the same function as a carry forward. A no-cost extension means that a project director is taking activities past June 30th, 2025. And you're not going to be able to close out. I think the cutoff was August of this year. If you informed that you were not going to be able to close out your activities by August of this year, you were told to submit a no-cost extension. If you are a new awardee and you are completely oblivious to what we are talking about, that is perfectly normal because no-cost extensions typically don't happen until year 4 of the award. So this question is coming from someone who is a repeat awardee. And so I would say, if you have further questions, reach out to your project officer because we don't want to confuse the new project directors. But in essence, you can only have a no-cost extension if you're going past the final day of the final reporting period, which would be June 30th of whatever year 4 is for that grant cycle. A carry forward is something that can happen any budget reporting period. So any time after, I think is it 90 days after the FFR, no, 30 days after the FFR is submitted. And that is typically, I think in the deliverables calendar, it says it's due like September 30th of every year. So the FFR is due 90 days after the final budget period, which is June 30th. So count 90 days. That brings you to September 30th. And then the carry forward has to be executed within 30 days of the FFR. However, if this is discombobulating, and this is your first time hearing these timelines, again, this may be perfectly normal. Don't panic. Reach out to your project officer, and we will make sure that you understand the context of all of these deadlines and all of these functions and forms that we are discussing.
I do want to confuse matters a little bit more, is that some of you all were funded as part of MC1 cohort. And so you will not have the ability to carry over. You will have to do a no cost extension if you have funding remained. And so I see that there's a little bit of confusion in the chat. And so again, if you have any questions about that, contact your project officer and they can go over the nuances of all of that.
Thank you. So there's a question, you must copy over the 1 goal and 5 objectives listed in the revised SWP guidance. You cannot create your own objectives other than those 5, correct? Yeah, that is correct. So use the goal and objectives from the template in that reference guide that was shared. So I'm just confirming that the question that says, I was under the impression that no cost extensions were for grantees who did not receive funding this round. Carry forward is for previous grantees who have been awarded via computing continuation. Yes, that is correct, with the exception of an MC1 grantee who also received funding. You would be considered a new award. So you would not be able to do a carry forward, like Cindy said. Would you be able to share the difference between the data report in the NCC versus the QPUs? Are the QPUs designed to aid us in the NCC content? They are, but what we can do is, in the past I've shared with my portfolio past examples of the NCC, past manuals of the NCC. So if that's helpful, we can share that with the program with all the grantees so that you know what the NCC instruction manual looks like. So you're prepared for that report in the spring. I think I made it to the bottom. I'm unable to change the goal in the SWP. Is anyone else having that problem? I can make edits, but it won't save the change. So you should be able to make the edits and submit. If you can't, I would recommend reaching out to Tier 2 support. It might be a technical issue on their end that they need to resolve. And I believe their contact information is in our slide deck.
There seems to be some issue. Courtney, do you know of any rationale for that?
I don't, other than we can submit tickets to EHB to assist in correcting the issue.
Okay. Thanks.
You can make so you can make some edits, like slight edits to your SWP, but you do need to talk to your project officer.
Somebody just indicated that they had a similar problem and they received a fix from EHB.
It sounds like it's happening to a number of SWPs, so that's good to know. Because it may not just be like one, may be affecting a certain group for some reason. If that is happening to you, can you also let your project officer know? Because we want to be aware if there is like a larger issue. All right. Oh, Leader Drury, do you want to add something?
Yeah, sorry, one more thing. Because I've met with quite a few of my project directors and I was talking to them about the prior approval for key personnel, but at this time that's no longer necessary. And so if you were changing your budget, you would still need to contact your GMS and your project officer. But if you are having turnover in key personnel, that doesn't require a prior approval at this time.
Yeah, just to reiterate that, it's only the project director that needs the prior approval in EHB. If you have any changes to your key personnel, there's an opportunity in your non-competing continuation progress report, that NCC report in the spring, where you can let us know there.
I'm sorry, I see another question in the Q&A. It was submitted 6 minutes ago. We heard that we were supposed to submit the NCE once we completed the FFR. Can we submit the NCE as a prior approval request now? I'm presuming that this is probably somebody that's a competing continuation. So I would probably advise that you link back to your project officer and your GMS.
Yeah, and if you don't know who your hopefully you've at least received an email from your project officer. But let us know if you also don't know who your project officer is, or you haven't been able to, you haven't been able to, get in contact because things have changed. So just let us know. We can help connect you with the right person. All of our contact information is on those earlier slides. Can you clarify the need for the blank document to be submitted addition to the SWP? I'm sorry if you explained this previously. So it appears twice, and we only need your SWP once. So that's the purpose. Instead of adding it twice or inputting it twice, you can just add the blank document for that condition, and it will appear for that attachment, and it will appear in EHB. So there's no need to duplicate it, is essentially what we're trying to save you from. Alrighty, well, really appreciate everybody hopping on a call, and there are no other questions. We can end early